So our faculty in health policy are engaged in a lot of educational activities and teaching programs and graduate training in different areas.
Those people may have been harmed by getting this treatment that didn't work.
We train undergraduates, graduate students, physicians, postdoctoral fellows, PhD students. It's one of the most enjoyable things we do, and it's one of our core missions. We've been training physicians, for example, for over 25 years in fellowships that teach them to understand how to analyze health policy problems, how to synthesize evidence, how to develop best practices. And these skills allow them to go out and become leaders in health service research.
So the VA Health Services Research and Development Fellowship is a VA-sponsored program whose goal is to really train physicians who are skilled health services researchers. Our program here at Stanford has a number of areas where we focus. One of them is on understanding and defining value in healthcare. Another area of focus is health system redesign and implementation. And as fellows, we have the opportunity to define our own interests, to set a research agenda, and to pursue the projects that really we feel most passionate about. And the third component is mentorship. So the program itself has dedicated faculty who provide both career mentorship and research expertise.
So there's like two components here.
We run master's programs in health policy, which have been very successful over the years, training a handful of people every year. A lot of that's focused on taking clinicians who have a lot of clinical skill and giving them the research skills and the ability to carry out their own health policy research as independent investigators going forward. But sometimes we train other kinds of people too. And then finally, we offer a doctoral program, and it's a bit of a new one for us, so we're very excited about it.
One of the things we think is unique about our PhD program is that we're situated on the main campus. And we have the resources of the entire university available to our students. So they can draw on experts in a really broad group of fields such as economics, healthcare, medicine, political science, psychology, engineering, and there are really very few places who are able to offer that broad array of both skills and fantastic expertise.
I started the PhD program with a very basic questions, such as what is a good health policy, how I can evaluate it, and eventually how I can support the decision making for a good health policy. I found that PhD program is a very structured way to train myself with established approaches in the field, as well as discover a new knowledge in health policy field.
I currently teach a course called Healthcare Systems Around the World. It's focused on undergrads, and really the underlying theme of the course is that we are integrating high-income countries and low-income countries into one course.
One of the things I like most about the PhD program here is that it's a really supportive and collaborative environment. I've never felt an air of competition with my peers.
I teach a health law class that focuses on public health law, and it's essentially thinking about constitutional law as it applies to topics like how can the government make people get vaccinated, or what are the limits of due process for civil confinement for mental illness. And in that class we had about a third physician candidates, med students. We had about 2/3 law students, and there were also a smattering of other grad students from around the campus. And they really brought very different perspectives to the classroom.
You've got physicians in the same class as engineers, as medical school students, as students in informatics, all thinking about the most challenging problems in healthcare and working in teams to use everyone's best skill sets to solve challenging problems.